You're watching Ct TV. Knowledge is power.
So sarcomas are typically diagnosed with a combination of tests. Often patients have a painless lump. And if you have a lump that's swelling and is not causing you any pain or any real discomfort, that's something to check out. Because if it's an infection that's causing a lump or a swollen lymph node or something, then that's obviously not the same thing, and it's going to cause some discomfort. Whereas sarcomas often don't cause discomfort, and that can be something that prevents patients from having them treated or tested. So definitely, it can delay diagnosis. If you have some sort of lump that appears and is constantly growing, that's something you want to have looked at, and you want to have that looked at as soon as possible. So there's a variety of different imaging modalities. Often you can start with ultrasounds, and then if the ultrasound looks suspicious, you could go to an MRI or a CT scan, and then obviously a PET scan is the best way to go.
Mm-hmm. We're going to get there in a moment here.
Yes.
I just wanted, I think so often people don't understand the difference between CT, MRI, and PET. So tell us a little bit about how CT scans and MRIs work.
Yeah, so CT scans and MRIs both use a different medium. CT scans use radiation. And what they do is they blast a beam of a specific type of radiation through your body. And then they have a collector plate on the opposite side that picks up the actual radiation and determines how much was absorbed in a certain area. And so denser tissues are going to absorb more radiation, and lighter tissues are going to absorb less radiation. So if you have an organ that is a consistent type of tissue, such as a liver or a lung or something, and then you have a lump that is a different density, either more dense or less dense, then that's going to come out on the detector on the opposite side. And then the computer aspect of it will turn it into an image. And that image will have some sort of, it'll be like a shape or a shadow. That's what we like to call it, shapes and shadows. So typically what happens is doctors will take the measurements of that shape, and then they will check you out again in another 4 or 6 months and see if it's grown or not. That's typically how imaging is used in standard care. But it's important to note that this is a shape and a shadow, and it's not necessarily a cancer. Many benign lumps can occur in people in different organs. And so just because you have a lump, it doesn't mean it's an actual cancer.
Thank you for watching Ct TV. Subscribe below and stay informed.